I'm the student PTA at Penn State Hazleton. Is it okay if I work with you today?
Of course.
Perfect. Can I verify your name and date of birth?
Valley 939 2004.
And do you know where you are today?
Penn State
And what day of the week is it?
Monday.
Perfect. So today we're going to be doing some different exercises and treatments to improve your function and normalize some of your movements, because I see on the chart you did have a right-sided CBA 8 months ago. Is that correct?
Yes.
Okay, so that means it's going to be affecting your left side, which I know you know. So the things we're going to be doing today are PNF, which is proprioceptive neuromuscular facilitation, and this is just to help you with that movement that's necessary for function, because I see that you have difficulty completing your range of motion while putting on pants and dressing.
Yeah.
So we're going to do that to improve that area, and then we are also going to be doing NDT, which is neurodevelopmental training for your sit to stand transfers. That will just be working to increase the weight bearing and function on that left side, because we just don't want to compromise and use your right side more than your left. We just want to make sure that's even. And so throughout all of this, you might experience some soreness, fatigue. It might be just uncomfortable, some of the motions we're doing, and just using that side more than you're used to. You may also experience loss of balance, since we will be standing up, so I'm just going to put this gait belt on you for just your safety and mine throughout this. So if you could just, there we go. And throughout this, I don't want you to have any pain, so if you do, let me know.
Okay.
And same with when I send you home with a home exercise program, you shouldn't have any pain with that, and if you do, I want you to stop and we'll go over that the next time you come.
Okay.
So speaking of pain, do you have any pain at this moment? 0 being no pain, 10 being the worst pain imaginable.
Maybe like a 1.
A 1? Okay, good. And before this incident, what was your prior level of function?
I was really independent with everything.
Okay. So in addition to dressing, are there any other day-to-day activities that you're struggling with right now?
Putting my shoes on and then just kind of getting up and moving around in the bedroom.
Yeah, okay. Yeah, that makes sense. And what would you say your goals are for therapy?
Get to act as independent as I can.
Perfect. We will work on that. So first I just want to check your skin on this left side, where you don't have as much sensation. Check your hips, knees, and I will also be checking your foot. So I just have to take your sock off here. I can see that you're all good, so I'll put that back on. I can get it the right way. There we go. So next we're going to do some goniometry. So I'm just going to move around here. And if you can roll towards me, please. Perfect. We're going to be assessing the range of motion of your left hip. We will be doing extension, so that's just lifting your leg off the table. Can you show me that? Very good. Okay, whenever you're ready, you can do that motion again. Okay, go back down. You were at about 15, normal is 20, so that's good. Stay there. And you can roll back towards me. Perfect. The next thing we're going to be doing is that PNF that I was talking about before.
Okay.
So for this motion, it's a functional motion.
Okay.
So you're going to be slightly away from your body with your leg. Your hip's going to be turned in.
Okay.
Toes pointed down and out, just like that. That's the starting position, and then you'll be coming up, have your knee, or your heel come up to your other knee, just like that, and then you'll be pointing your toes up, just like that. Very good. So now I'm just going to show you that motion passively
Okay.
a few times until you get the hang of it, and then we'll get started on the active.
Okay.
On the active sets. So you're gonna be out, toes pointed down, up, down and in. Very good. I can feel that you're getting the hang of it. So now we're going to move into the active
Okay.
ones. So I'll just have my hands here just to promote that movement,
Okay.
but I will not be resisting you. So I'm going to do a quick stretch down, come up, switch, quick stretch up. We're going to do 10 of these. That's 4, 5, 6, 7, 8, 9, and 10. You can rest now. The next ones that we're going to be doing, pretty much the same, but I'll be adding some resistance at the end range because I see you're having difficulty completing your range of motion. So I'll be adding 3 either push or pulls at the end,
Okay.
and I want you to resist that movement.
Okay.
We'll do this one 3 sets of 10.
Okay.
All right, do you feel ready to go?
Yep.
Okay, let's get to that starting position. Very good, I'll do quick stretch down, go ahead up, going to 1, 2, 3, quick stretch up, down, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, and we'll say that was 10.
Okay.
And then we would do 2 more sets of those as well. Okay. So for your home exercise program, I want you to do that same motion that I just showed you, but
Okay.
you're just going to be doing it actively. You don't need a second person to be there to help you with that. You won't be doing any resistance. You're just going to be doing that motion actively. So can you show me that motion just to make sure I know? Very good. You will be doing that 3 sets of 10.
Okay.
Once a day, every day.
Okay.
Okay. And you should have no pain with that again. If you have any pain, I want you to stop. Got it. So, next thing we're going to be doing is that NDT treatment I was talking about. So if you can put your shoe back on for this. So if you can come and sit at the edge of the table for me. Very good. So for this, I will be having one hand down here and then one hand on the gait belt here to be able to control your hip and then make sure you're getting your body weight onto this.
Okay.
Your weight bearing onto that left side. Okay, we're going to be doing this twice.
Okay.
I want you, when I tell you, you're going to be leaning forward, getting your head over your toes, and then standing up while using that right hand to push off
Okay.
of the side. Okay? And I'll be blocking this side as I pull you closer to me to get more weight bearing. Okay? So first I'm just going to anterior shift and then stand up. Very good. Pull you towards me. Stay there for a little bit. Okay, we're going to shift that way. Lean back onto the table. Very good. How did that feel?
Not too bad.
Okay. Could you tell that you were bearing more weight on this left
Yeah.
side? Okay.
It was definitely challenging.
Okay, very good. Are you ready to do that again?
Yep.
Perfect. So we're going to anterior shift, stand up, shift this way, shift back, Good. How do you feel now?
Good.
Good? Alright, you can lay back down. Now for that, I would have a second person there for safety. And that's something that I will be telling all of your caregivers. I want you to do that with all of your sit-to-stand transfers from now on.
Okay.
You shouldn't be doing a sit-to-stand transfer without doing that technique.
Okay.
Okay? So now I just want to check your skin again. Make sure we're all good here. Good there. Check your feet again. Okay, we're good. Okay, and now I'm gonna have you roll towards me again. Very good, and just show me that motion I measured earlier. Very good. And you can roll back over this way. Good. Very good. I'll put your shoe back on. Are you having any pain now? 0 being no pain, 10 being the worst?
Probably still the same, the 1.
Out of 1? Very good. Do you have any questions for me?
I don't believe so.
Okay, thank you for letting me work with you. I'll take off your gate belts.